This is a great way to start the conversation, because what we do on the show here, we try to break some stereotypes and taboos, because at times we think, the way you've always thought about people, the way you've always thought about yourself is actually the best way to see life. But most of the time when you do investigations or you learn more about life, if you're a person who wants to grow, you'll know, what, this part of my thinking is not the best way to think. Maybe let me evolve this thing so I can actually see things from the other person's side. And people that we usually take for granted are people with disabilities. Yes, we do that because we call them disabled people. Some years ago, an expert, when I was doing an interview, and I kept on saying disabled people, stopped me in my tracks and say, don't call them disabled people, Ben. I'm like, why? This is what we've been doing all the time. I mean, I've heard it from other people, and people always say they disabled people. Say, no, because if you call them disabled people, you characterize someone's humanness based on their disability. So you're saying you are who you are because you are disabled, and that's not the right way to think about it. In fact, we must call them people with disabilities. They just have a disability, but that disability doesn't make them who they are. And today we're going to be looking at an interesting conversation around women with disabilities. And most of the time when we think about women with disabilities, or even men with disabilities, we don't really think about the sense of them being like us, especially when it comes to their sexual needs, their sexual wants, their sexual preferences, but also their sexual rights. And that's what we're going to be talking about today, zooming into a study that took place in Lagos, and that's in Nigeria. And this is an interesting one, because despite growing global interest in sexual and reproductive health, the voices of women with disabilities have maintained largely unheard, especially in low and middle income countries like Nigeria. But a group of global health researchers and authors conducted a study that explores the sexual experiences of women with disabilities in Lagos, Nigeria. We have one of the researchers who's joining us on the line, Dr. Obasanjo Bolarinwa, who is a senior lecturer and school research knowledge transfer co-lead at York St. John University in the United Kingdom. Hey, come into our stream, and I see people are coming into our stream, so you're welcome to do that, because our guest today is joining us on that live stream, which is fantastic, so you can see our guest as well on that live stream. Dr. Obasanjo, welcome on the show. It's good to have you with us.
All right, thank you, Benjamin. It's my pleasure to be here.
Yeah, I mean, let's talk a little bit about the context of this conversation, because it's pretty cool from where I'm standing. And I think it's such an important conversation, because we'll never use words like who when it comes to this one, because we'll think, no, listen, this is not something that we should even be talking about. That's such an awkward conversation. No, it is not awkward, because persons with disabilities have the same sexual needs, sexual wants. They're people like you and me, Doctor.
Absolutely, yes. And I also acknowledge the fact that you did mention something around not calling them disabled, but women with disability. Yeah, thank you for that, sharing that knowledge with our audience and large audience. Yes, I agree with you. And there are a lot of misconception about the sexuality of women with disability, and it's one of the reasons why we conducted the study as part of large study that we conducted in sub-Saharan Africa.
Yeah, let's talk a little bit about that, that journey that you took. I mean, what was the initial inspiration behind the study? What was the thing that actually caused you to actually say, you know what, this is such an important talking point?
All right, thank you very much, Benjamin. Besides my own personal experience, I mean, having someone who is disabled within my immediate family, I am also a researcher who deals with human behavior as a demographer as well as a public health scientist. So we underscore, I mean, this study was conducted as part of larger study that we conducted in sub-Saharan Africa to look and understand the experience of women with disability when it comes to their sexuality. And the project name is Disability and Sexuality. And it's largely part of my PhD study at University of Witwatersrand under my supervisor, Professor Clifford Odimigwe. The motivation is also very simple. I mean, there has been persistent invisibility of women with disability in terms of their sexual and reproductive health, especially in sub-Saharan Africa. I mean, despite the global attention around around reproductive rights, lived experience of women with disability is largely overlooked. So, and then there is really this stereotype about the fact that they are not asexual, they are sexual, or they are always claiming to be victim. So, conducting this study as part of a larger study make us understand their perspective and things that are probably missing that people need to know about.
So you focused on Lagos, Nigeria. Tell us a little bit about that choice that you made to actually focus on those women in Lagos, Nigeria, who are women with disabilities. What was the rationale behind that?
Thank you. To take you a bit through the journey of the project, like I said, it was conducted in 10 sub-Saharan Africa, including South Africa as well. So we had Ghana, Nigeria. So the choice of Nigeria was because Nigeria is the largest most populous country in Africa, and Lagos happens to be the hub of high economy in Africa as well. So we believe having 20 million population people in Lagos will give us the ability to be able to see correspondent or participant that would be able to attend to our questions and getting more information from it. So although it's purposely chosen, however, looking at the indicators I've mentioned, having the largest population in Africa and Lagos being the most economical hub in Africa as well. So we decided to conduct a qualitative study in Lagos. However, the quantitative study was conducted in 10 countries in sub-Saharan Africa where we use demographic health survey data sets, and we do not have to necessarily visit those countries.
All right, let's take a bit of a break. We'll get some of the context in getting into the study. What were your key findings? And I'd like us to start with that when we come back on the break, because that is going to be something that's going to maybe stun many of us, because we really pigeonhole people with disabilities, otherize them in terms of making them as if they have an alien kind of type of being. And I think most of the time that is where the problem is. We never integrate them into our normal society. They still, I think, continue to be in the peripheries of our societies. We'll come back to you, Doctor, to unpack this particular theme, to find out the key findings in your study. Indeed, today we're looking at a study that has been pioneered by Dr. Obasanjo Bolarinwa, Senior Lecturer and School Research Knowledge Transfer Co-Lead at York St. John University in the UK. It's asking a very pertinent question in terms of looking at the voices of women with disabilities and exploring their sexuality as well. So we'll be looking at that after our break. Thank you for everyone who's coming into that live stream. We've got the doctor on our live stream in our Zoom feed, so you can see the doctor if you follow us on our @Channel Africa handle on Facebook as well as on Instagram. Don't forget our YouTube page as well at Channel Africa 1.
9 to 12 midday Central African Time. On the move with Palesa and Benjamin Moshatama.
Now, when we speak about the sexual and reproductive health rights of women in general on the African continent, we can confirm that those are still highly stigmatized, that they're highly overlooked, and there's still a lot of work that needs to be done to push the rights and sexual rights of women all across the continent. Now, imagine how much worse it is for women living with disabilities. We're unpacking a research done by global health researchers who conducted a study that explores the sexual experiences of women with disabilities in Lagos, Nigeria. One of those researchers, Dr. Obasanjo Bolarinwa, still joins us on the line to unpack this. He's the Senior Lecturer and School Research Knowledge Transfer Co-Lead at the York St. John University in the UK, and he unpacks the study with us. Well, let's speak about some of the key findings. Firstly, we have one of the highest populations of persons living with disabilities here on the African continent. This obviously exacerbates the issue that we're speaking about today. But there's a huge misconception about the sexuality of women living with disabilities. And the first one is that we think that they are non-sexual beings. We think that they are asexual. Dr. Obasanjo, are you still there?
Yes, yes, thank you very much. Yes, I agree with you that we think that they are asexual. And to also confirm the statistics you mentioned, in our quantitative study, we did find out that South Africa has the highest frequency of women living with disability in Africa. So some of the findings were in 4 segments, actually. The first one is where we talked about the sexual activity and relationship dynamics. And many participants reported being sexually active, with some indicating that their disability did not stop them from being sexually active. However, there are challenges that were noted, such as physical limitations, ability to do different stuff or painful during intercourse. And then we have some mention in societal stigma affecting their relationship, such that maybe they are in relationship with someone and they say, oh, who are you dating? Someone with disability. Oh, no, you can't date that. And we have family also pushing back in relationship where somebody without disability and someone with disability are in. And in the second segment of the findings, where we spoke about the contraceptive use and the accessibility of it, which is the reproductive part of the study, there was a low uptake of modern contraceptive use among the participants. And this is because of factors like fear of side effects, the cost of it. Imagine someone who is disabled, who is unable to economically be buoyant for themselves, and they still have to buy contraceptives. And the other one that comes very strongly is the accessibility issue. And then they all rely on traditional methods. And this is a gap in knowledge, because what they don't know, they can't use. And there are also misconceptions about the fact that using contraceptives in Lagos, Nigeria, can make their disability worsen. For someone who is disabled, who is blind, believe that, oh, she will become more blind, something like that, and then this in their use. But again, the third segment, which is very, very important and intriguing, is the sexual autonomy and consent among the participants. So the participants demonstrated an understanding of sexual autonomy. They know what it is. However, they claim not to be able to exercise it.
Yeah.
Despite their awareness, despite the fact that it is happening, they claim that the autonomy is not for them, because whatever their partner says they do, the right is not for them, because they don't have a say in their sexual consent, which is actually a very serious situation. And lastly, about sexual violence. We know sexual violence in Africa is something.
Absolutely.
However, imagine with women with disability. So several women recounted their experience around sexual violence, including harassment, excavating because of their sexual experience. I mean, one woman spoke with us around not being able to call for help or shout because of her disability, and she can't even struggle with her abuser because she doesn't even have the power. Her leg doesn't give her the power to be able to struggle. So these are the experiences, and also lack of support around how to report these violences. They do not know who to contact, and when they even contact the family member, they have a pushback, like you just want to form victim because you have this leg issue, or because you are blind, you are just making things up. And these are the things that we are able to uncover from their experiences.
That's so.
And there are also recommendations.
Okay, we'll go into the recommendations. But I find that intriguing, because when you speak about autonomy, one would think that just because someone has a disability, they can't move in a certain way, and they do have a physical limitation. It's actually there, but that would sometimes people would interpret that and discount that as if the person doesn't have a choice or doesn't have an autonomy how their sexual experience is. Actually,
yes, absolutely, I agree with you. And this is also from the backlash we have as cultural myths around men being the head of the family, men being the one that will say when he is ready to do it.
Yeah.
So for combining that myth with cultural myth with what is happening in terms of women with disability who are actually in relationship or married. So they find themselves helpless, not to be able to say no when they are supposed to say no, not to be able to say, okay, I'm ready now. So they don't have any autonomy or to give consent on when it should happen, how it should happen, or where it should happen. And this is a major problem that we think there should be policy around it that would help, or kind of awareness that will improve or empower the women with disability and ability to be able to make the choice.
Yeah. Well, there's obviously so many layers to a conversation like this because there are so many people involved. The awareness of the women living with disabilities themselves, the awareness to their spouses, their immediate community and family members, but also awareness to public health and how to treat women with disabilities and how to make sure that their reproductive and sexual health rights are not inhibited. So stay on the line with us, Dr. Obasanjo. We're going to take a news break, and then we'll come back and speak about some of those recommendations that yourself and your colleagues came up with in this regard. It's 9:30 Central Africa time. Let's get our latest sports news.
Be on the move with Benjamin Moshatama and Palesa.
Thank you, ladies. Thank you to Buntle, and thank you to Musibudi for those updates. So we're going to wrap up our conversation today with Dr. Obasanjo Bolarinwa, Senior Lecturer and School Research Knowledge Transfer Co-Lead at York Saint University, that is in the United Kingdom. He's joining us in our live stream on our socials, so go check him out there. I see so many people coming in. I want to shout out to Ndidi Onwumer. I see you, man. You're always coming into our live stream. We really appreciate you having there daily on our live stream. There's so many regulars on our live stream that I see on a daily, so we don't take you for granted as well. I see so many of you also. Thank you for joining us. Alex Gondwe, Lonos Malekano, amongst others who are there on the live stream. If you want to see our guest and ourselves in studio as we interact, we've got our guest in a live Zoom on that particular live streaming. Remember, Channel Africa 1 is where you can find us on our YouTube page. And remember, we also simulcast that in our Facebook page. Dr. Obasanjo Bolarinwa was helping us understand the study that explores the sexual experiences of women in disabilities. They did a study that was specifically focused in Lagos, Nigeria. Doctor, if you are still there, thank you for waiting and being patient, and let's continue this conversation because we didn't want to rush the recommendations, right, on what should happen in terms to centralize women with disabilities when it comes to their reproductive and sexual rights. What does the study put on the table?
All right. Thank you very much again, Benjamin. One of the things that came as first for the recommendation is infrastructure enhancement. So this is very particularly useful in implementing disability-friendly facilities in healthcare centers to improve access to reproductive health services. Unlike many developed countries, what we have in Africa, especially Lagos, Nigeria, are not disability-friendly in terms of the facilities or the type of services that are being offered. Like rightly mentioned earlier, women generally face issues around sexual and reproductive health. Now imagine a woman who has a disability who is unable to then access the facility. So they are asking for infrastructure enhancement that will help them to be able to access the facilities as at when due or when they want to do it without any obstruction. And secondly, one of the recommendations we are also putting forward is also, of course, in collaboration with the participants of the study, is educational initiatives. They are requesting for that there should be a public education campaign to dispel the myths around disability and sexuality, and also to promote the understanding of their sexual rights, letting people know that they also have autonomy and they are supposed to utilize it as a when due, and they have sexual rights as well. So this educational initiative is not specifically for the women with disability, but rather for the general population in Africa, and strongly talking or hitting on the nail on the head around the cultural belief. And the third one is around policy and legal reforms. It is believed that with all of the overall project and some of the in-depth review we also did, we found out that there are no specific legal protection that is specifically for women with disability. Like we said, when it comes to sexual violence, almost all women are vulnerable. However, the vulnerability becomes triple when it comes to women with disability, or become more intense because of their inability to also defend themselves. So they are asking that there should be strengthening legal protection against sexual violence, ensuring enforcement mechanisms that are accessible to women with disability, that they know where to call, where to go, when to do it, how to do it. So this is within the policy and legal reform. And lastly, but not the least, that is also very, very strong and important, is the community support systems. I remember a lot of theory that speaks about if communities are together, then the community will become very strong. So for us and the women with disability, we believe building a community support system that will be able to look after each other would help them to be able to access all of these sexual reproductive services, and as well as reduce the sexual violence or eliminate the sexual violence they usually experience. So establishing support networks to provide assistance, counseling, and advocate for affected individuals who are living with disability, irrespective of gender now, either male or female. Because like Benjamin rightly mentioned, the gender aspect is not really looked at, because we do have men who are also living with disability. But as I said earlier, this is a bigger project, and we are also looking at expanding it in connection with my university here in the UK, as well as University of Witwatersrand, under the auspices and the supervision of Professor Clifford Odimigwe. We are thinking of expanding this to cover more African countries, while we seek funding to also ensure that these important studies and all of these interventions are implemented. Thank you.
Well, this is certainly very important and incredible work, Dr. Obasanjo, work that is necessary to continue growing and understanding the sexual and reproductive rights of women in general, but also especially women living with disabilities, seeing them as human, understanding that they are, just like all of us, and they, have a right to love, have a right to pleasure, and a right to safety and choice. And those are really big aspects of, forwarding the rights of people with disabilities all across the world. So thank you so much for helping us unpack this particular study with us today.
Thank you for having me. It's my pleasure.
That's Dr. Obasanjo Bolarinwa, Senior Lecturer and School Research Knowledge Transfer Co-Lead at the York St. John University in the UK. Speaking about research, speaking about women with disabilities and their sexual and reproductive rights, and exploring what exactly are the inhibitions, the stigmas, and the needs that women with disabilities have when it comes to their sexual and reproductive health rights. It's 9:50 Central Africa time. Let's hear your thoughts on this conversation. Continue joining our live stream on Facebook with Channel Africa and at Channel Africa 1 on Instagram and Facebook. But you can also engage with us on our other platforms like X. Use our hashtag on the move. That's at Channel Africa 1, and on WhatsApp +27 63 406 9126.